I was living life as normal that day, and she called me and said, we're having these babies within a matter of a couple of hours. And within 17 minutes walking the front door, I had 2 new sons.
I had him at 30 weeks and 5 days. Robert was 3 pounds, 8 ounces, and Thomas was 2 pounds, 7 ounces. Robert was here for 56 days, and Thomas was here for 90 days.
Respiratory, are they over there? Weights 560.
Clear Lake Regional Medical Center NICU is a level 3 NICU, basically the highest acuity except for ECMO and pediatric cardiac kids.
We offer state-of-the-art facility to take care of the patients of our community. We offer a variety of subspecialists here, and we do a variety of surgical procedures for our neonates. In addition, we have a neonatologist and a neonatal nurse practitioner that provides us with 24-hour, 7-day-a-week coverage. Here at Clear Lake Regional, we're not a teaching facility, we're not a research facility, and we're able to really focus and give individualized, undivided, exceptional care for our babies.
The obstetrician will do a consult to us, and that way we can meet the parents before they are admitted at the unit and talk to them about what to expect, what complications we may see on babies that are premature. That way they will have in mind what it means to have a premature baby, know what to expect out of what we're doing in the NICU.
You know, it was very hard. You leave empty arms, you have nothing. You go down and you leave and you feel like you're leaving them behind because we do live 2 hours away. We can't come up and see them just when we want to. They would either call me daily or I would check in 2 to 3 times a day. And they never were upset that we called so many times. They encouraged us to call and to bond and interact with the babies. We were able to come up a couple of times a week.
Whenever we take care of a baby and we try to include the parents in the discussion of the baby, some of these parents may be present when we do rounds, and in rounds we kind of explain to them this is what the baby has been doing, and then after the rounds is over, then we ask them if they had any questions. So we try to involve them in the care of their baby.
They made their rounds and they didn't talk just medical terminology where you couldn't understand or talk down to you.
It's like talking to your next door neighbor.
Like friends and family.
Our babies were also here during Tropical Storm Harvey, and we were turned away trying to come here the day Harvey hit, and the police turned us away. So we couldn't be here for about 11 days, and the medical staff here kept us updated. They gave us progress reports. We were about power being out, and they assured us that our babies were well taken care of.
Robert left when he was 56 days old. It was very hard leaving Thomas behind because they've been together their whole time, and we felt the guilt of taking one baby home and giving him all this love and leaving Thomas here. The nurses, they would relay the love. I would talk to them and they're like, we're snuggling him, we're loving him and stuff like that. It was just very comforting to know that all the feelings and emotions that I was going through, that they were actually giving it to Thomas because he was here by himself, because you knew that they received the love and care, because when we got him home they expected us to love and care for them much. So it was a really good thing.
Just the experience from the doctor sharing information with us and not treating us as an account number, but as a viable, breathing parent, that we're going to take care of you. We know you're scared and we're going to guide you. And that kept me from falling apart myself.